for 2021, we started to see some of those things that, the social determinants of health, how we can help the members help by doing things outside of medical attention, the over-the-counter benefits, and the way that we do that is different than a lot of our competitor carriers. The key to our success, I think, is to continue to try to offer the things across the board that are going to make our members more healthy.
Good morning, insurance agents of the senior market. Welcome back to another episode of Near and Far. It is Friday, June 4th. Hope your June is starting out really well. I know that ours is. So excited to be joined today by my very good friend, Rodney Rains, a sales director for national distribution with UnitedHealthcare. So Rodney, the question that all of our agents want to know right off the bat, what are the details on the 2022 MA plans?
Well, we'll find all of those details out in July.
Okay.
We have our national rollout in Miami, July 28th. We'll push that stuff out. But we have been able to provide some information around expansion. I'm sure you all have shared that information with your downlines and your agencies. So some teasers out there to get us started.
I've been trying for days to crack Rodney. Like I feel like I've done everything possible. Like I've offered gifts, I've offered enticements. I offered him any number of things. And I'll tell you what, to all of the folks in Minnesota, this guy will never crack under questioning. He won't do it. So if you got secrets to tell, you got to tell Rodney.
And Bill, we can't accept gifts. So. Just throwing that out there, that would never work.
Well, my agents would blame me if I didn't at least try to do that.
Fair enough.
Yeah. So I would tell you guys that Rodney is one of the best Medicare and relationship people in this business that I've ever worked with. And today I'd really like to get into sharing some of your insights, not just on the Medicare business at large, but kind of UnitedHealthcare's place in the market. And I think that would be helpful. So let me ask you this question first and foremost, just on a general basis. You've been working in this space for a very long time, and you've interacted with all sorts of agents when you were directly working with agents down in South Carolina as well as other places. What do you see as the difference between agents that are successful and agents who are not in the Medicare business?
Good question. So, yes, as you mentioned, I've worked directly with agents as an agent manager back in my home state of South Carolina for many years, and of course now a little broader across the nation. But I think it really comes down to just a handful of things, pretty well industry wide as a standard, and it starts with, I think, love for what you're doing. Agents that really enjoy what they're doing, taking care of that senior population. That's probably the key the first key to it. And most everyone that's in the industry, they have that. That's why they're doing what they're doing.
Yeah,
so
that's a
check
great point.
one, right?
Yeah, I'd agree with that wholeheartedly. That it is so difficult to be successful at something if you don't enjoy it. It's sort of like you and I've talked a lot about our kids and youth sports, and one of the things that I've always said is that if you're not having fun, you're not going to get better. And I think the same applies to adults in the professional setting.
Absolutely, yeah. So then the next thing to me that really stands out is engagement. And I look at engagement from a couple of different things, but I'll start at the top, kind of broadly speaking, engagement in education, trainings, taking advantage of the resources that are available to learn and further educate yourself. And, the things like we're doing now, folks are taking the time to listen in, hopefully, and maybe pick up a few tidbits. But, all the carriers across the nation provide a lot of trainings, a lot of education. And of course, you guys as the NMA partners, the FMO partners, depending on where you're at. But the resources that you all provide are truly extremely beneficial to furthering that success level. And I think agents that take advantage of that are going to be inherently more successful.
Yeah.
And then you look at just how the interactions with the membership, right? The prospects, the folks that we're serving, and I think that's the area that can be a little more difficult to be as engaged as probably the most. I think the more success an agent is having, the more engaged they are with their members. So, doing the follow-up contacts after the enrollment. I think all agents are doing enrollments. Hopefully, or they're going to have to find a new line of work.
Yeah,
right?
that's true.
So I think the key to success and the most successful agents is to follow up after the enrollment. Taking care of the members, getting them involved with what their health plan offers, having them do their health assessments, doing their health assessments for them, helping them take advantage of the screenings and the offerings that all the carriers provide. I think that's a very big part of it. In doing that, you create retention with your membership, right? Which is, if you're writing, let's just say 100 applications, the level of success after 6 months, if you've got 100 applications still on the boards, then you're going to be successful.
And the best sale, the best sale is the one you don't have to make twice.
Exactly.
Yeah.
Exactly. If you're not doing those things and your 100 applications is, down to 80 after 6 months, then that's the difference between a highly successful agent and a lesser successful agent. And I think that comes from the engagement with that member, doing those things, doing the follow-ups, the annual touch bases, and you can't do it enough. Yeah. And that, to me, that leads to success.
Yeah, no, I'd agree. One of the, I think the things that I took out of your second point on engagement is when we think about the folks that work for Neishloss and Fleming that are the most successful, like the common thread almost always, it's not your college background, it's not what was your major, it's not your previous work experience, it is thirst for knowledge. Like, do you have that questioning spirit? And that's the case here. And I would also agree that for an agent, the agents that are calling us with really insightful questions all the time, they're constantly broadening the tools in their toolbox. And I would agree 100% that type of thirst for knowledge and engagement is what leads to an agent who's constantly developing and able to offer the best to their clients.
Absolutely.
Yeah, for sure.
Absolutely.
So UnitedHealthcare really got very heavy in terms of expanding their MA-only products for 2021. I mean, for a very long period of time, Humana was really the market leader in that space because they were everywhere, specifically with their veterans initiatives. And, every Humana rep you would talk to, it's MA-only, MA-only, it's coming. Aetna expanded a little bit with their MA-only products for 2021. You guys really went after it. I mean, that was a key takeaway from your rollout meeting for 2021. What's behind that focus? That it's seemingly you guys looked at the dartboard and said, we're going after MA only, and just kept throwing them at the bullseye there.
So to your point, 2021 was a huge expansion for us in the MA only space, the Patriot plan, we call it. And I think, in years past, we had those plans in about 12 states, I think. And then last year, I think we expanded, or 2021 year, we expanded by about 36 states. So now we're offering that plan in the majority, across the majority of the country. I believe it's 46 states or 44 states. But
it was a massive expansion.
And, we had some success with the plan offerings that we had. And I think we just saw it as another opportunity to make the health care system better for everyone, and certainly our predominantly veteran population within that plan really had an opportunity to give them some additional benefits and to give them some additional options for their health care and some of the things that they don't have through their whatever VA plan they may have in place. So I think it was, for us, it was an opportunity to serve more folks, and most importantly, serve some of those veterans that we want to take care of.
I'll tell you, it was astonishing to me when, and I don't know, and I'll be honest, I don't have an issue saying that there was something I didn't know. I was not really aware of the percentage of Medicare recipients that have access to veterans coverage prior to United making that huge expansion last year. That's when it really popped on my radar. And when I delved into the fact that 1 out of 5, 20% of Medicare beneficiaries have access to some level of VA coverage, it was like,
Yeah.
that was just astonishing to me, because I'll be honest, I had just really ignored MA only. Like, it just wasn't something that, was super on my radar. It was very much more in tune with, traditional MAPD plans and special needs products, DSNPs, chronic illness plans. And, that was just eye-opening to me about what that market really is.
I think, to your point, it's a tremendous opportunity. And I really believe in 2021, even with all the expansion, we're just starting to scratch the surface of what's out there for those folks that feel like they're pretty well taken care of and don't realize that maybe there are some additional things that they can take advantage of. And a little teaser for 2022, I think you'll continue to see some pretty solid investment in that product and that piece of that piece of business that we're looking at.
Awesome. So moving on off of MA only, I'd mentioned DSNP, which has always been a big focus for me. I first got introduced to that product in 2008. My good friend Renee Williams with the old Evercare product, and with that UnitedHealthcare was part of their, that's kind of where I kind of cut my teeth in the DSNP market. Mm-hmm. But UnitedHealthcare has long been the market leader in the DSNP space. I mean, that reputation is really clear. What do you think is the key to United's success in the DSNP market? Because there are so many DSNP products that are available, and there's been a lot of expansion. You're seeing Humana get much more involved in DSNP space. Aetna, huge expansions the last 2 years in DSNP, and many other carriers, some of which are just DSNP focused, play in that market. But year after year, United continues to be the leader in the DSNP space. What is the key to success, specifically with those individuals on Medicare and Medicaid for United?
Well, I think it's certainly a priority. It's a population that has probably traditionally been underserved, and UnitedHealthcare has truly taken the opportunity to make that a priority and really design plans that are extremely beneficial to those members. And we can talk a little bit about some of the things that make that the case, but it starts with the model of care. The things that come along with that plan, and I know that a lot of the carriers offer similar things, but I think UnitedHealthcare does it better than most, and it's a big focus. We are constantly talking about how we can better serve those individuals. And for 2021, we started to see some of those things that, the social determinants of health, how we can help the members' health by doing things outside of medical attention. The over-the-counter benefits, and the way that we do that is different than a lot of our competitor carriers, in that in-store benefits. You talk about how an over-the-counter benefit works, and when you can have, which many of our plans have the in-store benefit, you're taking advantage of real pricing. You're taking advantage of sales. A lot of the places offer buy one get one free days, Tuesdays, and Thursdays.
Everyone loves BOGO. Yeah,
that's right. So when you have that in-store credit, if the dollar amounts are the same, you're getting a lot more out of that. Yeah. Providing the food cards, the healthy food cards. So things like that can help. One of the other things that we did this year was on many of the DSNP plans was eliminating the copay for medicine prescriptions. So I think that was hugely successful for that population this year. And so, the key to our success, I think, is to continue to try to offer the things across the board that are going to make our members more healthy.
Yeah. Well, and I've talked to agents about United, and to me, what makes the difference in DSNP. And I can remember 2010, 2011. That our persistency on that product wasn't good. And not just United's product, but just DSNP in general, like just wasn't good persistency. And there was a very true perception in the market that yeah, you're right, DSNP. You're going to be writing for every 2 you write, one's rolling out the back door in 6 months. Like, and that's, and a lot of people still said, yeah, I'm still getting into that. I'm still doing it. I'm just going to take it in stride. And I can remember when UnitedHealthcare put in a member outreach model where they were reaching out to the new DSNP members, not just the ones that the field sales, the actual ISRs and ICAs wrote, but external distribution. Our agents would write a member. And they were touching them at 15 days, 30 days, 45 days, 60 days, 90 days, engaging with that member. Did you get your ID cards? Have you gone to the PCP? And now a lot of that had to do with star ratings where they were trying to drive certain activities, but it was not instantaneous, but so quickly we saw our business just staying on the books longer. And that's just such a key thing for our agents in engaging in the DSNP market, that when they write with UnitedHealthcare, agents who have been doing it like for a period of time, what they see is their persistency on that product is so much better because United's member engagement is just really high in that space. And I think that's invaluable for an agent to think, okay, well, what's the difference between, my persistency year over year being in the 90s versus being in the 80s? It's tens of thousands of dollars a year if you're engaged in that business.
Yeah, again, it leads back to to your first question, right? Successful agents helping with that engagement, but certainly it's a focus for us. Retention is just as important to us as it is at the agent level, and so it is definitely a very specific effort to keep those contacts and keep those members on the book. And I'll tell you something else that I know but those folks are they are very likely to talk about things that they appreciate. And that's a great source. The folks that are really agents that are really successful in working that DSNP space get a tremendous amount of referrals from that engagement and from assisting that member getting the benefits that they have available to them.
Well, and that's a great point, Rodney, because we talk on this show as well as other shows that we do here at Neishloss and Fleming all the time about how DSNP is the single best referral generator. That folks that are DSNP members, you are so much more likely to get referrals out of that group as you are, if you want to call them traditional MAPD members. That's exactly it. If you do it wrong, they're going to tell everyone they know that you did it wrong. If you did it right, you're going to tell everyone that you know. So agents that know how to do this business the right way and are placing business with carriers that do business well, it's just going to be a huge boost. And a referral is the best thing ever because it's a lead you don't have to pay for.
Yeah, exactly. And we'll continue, from a UnitedHealthcare standpoint, we'll continue to stay on top of that and continue to have that priority. Over 300 more counties that we'll be expanding into this year. What was it, Bill? Just a couple of years ago, we had the drive to 1 million members for UnitedHealthcare DSNP membership, and of course we well passed that last year, and continue to really expand our membership in the DSNP, and we'll continue to do that.
Yeah, and even in markets where United's had their DSNP product for a long period of time, it still blows my mind how many dual eligibles don't have a DSNP product of any kind. Agents talk to us about green grass all the time. Where's the green grass? Where do I go to find it? And we talk about DSNP all the time. And Chris Holmes in our office is a huge champion for the DSNP business. He's done a ton of videos specifically on that because he used to write that business as a field agent. And we're constantly talking about the green grass is with Medicare and Medicaid eligibles because it's an underserved population, and there's virtually no reason not to sign up for a DSNP product because
that's right.
You get such a better experience, not just from clinical care perspective, but the added ancillary benefits.
Mm-hmm. And it's, it kind of like we talked about with the MA, folks, they think they're okay. They think the Medicaid is taking care of them, and then they have no idea what else is out there. And, they don't lose their Medicaid benefits. So if they have things that Medicaid is doing to take care of them, they don't lose those benefits. They just gain the benefits that a DSNP carrier, UnitedHealthcare, is offering.
Yeah, and beyond that, provider access, which is a huge thing. There's so many providers that are part of a DSNP network of doctors and hospitals and just general physicians that aren't part of the Medicaid network. So that's a really good point. So specific to your work with agencies, like that's really your primary responsibility now. You're working with larger agencies across the country. When you look at agencies that are really growing, not agencies that are kind of treading water, and just kind of putting up nice results, but agencies that year over year are just stepping it up, increase in recruitment, increase in production. Is there a common thread that you see with those shops that really seem to be gaining ground year over year, just in all your travels, all the people that you're working with?
Well, when I look at agency growth, that's certainly something that we look at on a daily basis, right? I kind of look at it from a couple of different perspectives. The first being just the growth in agents, the growth in sales and agencies and that sort of thing, and which leads into the second thing that I would like to touch on is membership, right? So really how we look at growth is in your membership, right? Total membership. But to circle back to the first thing, the agencies that are really thriving are the ones that are providing resources like this, are providing the support, the training, that have the resources to take care of their agents and their agencies, and that actually do that. There's a lot of varying levels of support there, but certainly the agencies that are very much involved. We were talking this morning about all of the different things that you all have going on to support your agent base, your agency base, and I think that's the key to success. Going back to the agent conversation, that was the first thing we talked about, right? Providing those resources, so that grows your agent base, that grows your opportunity as an agency, and then when you look at membership, which is the true definition specifically for us as a carrier, we're looking at membership growth. A lot of the same things that make an agent successful. A focused effort on retention is probably the biggest thing. I mean, sales are sales. You're doing the other things. You're providing the resources. You're providing the support. I look at what you all did collectively as a group of external distribution partners through the pandemic, through AEP specifically, the way that you all were able to provide those resources to help the agents get on board, do business in the environment that we had was just absolutely astonishing to me. I mean, we saw some very significant growth through a very difficult pandemic. And that was a result of the resources that you all engaged with and provided to those agents. So that's, so the sales are certainly one part. You got growth in sales. Retention is the other key part. And I know everyone hears a lot more about retention these days than they did, say, 2 years ago.
Well, it might be that carriers are talking to us about the terms.
That's right.
It might be that those conversations happen, so we get real focused on retention.
Go. Yes. It's certainly an important thing for us to do because retention, you mentioned it earlier, it's a lot easier to keep the sale that you already have than to go out and create a new one. So, it takes all of us. It takes the carrier, it takes the agents, it takes the agency support to help make that happen. So, that's to me, those are two of the biggest points that make a difference globally in the success and growth of an agency.
Yeah. Well, and talking about retention, there's a hockey coach that I've listened to a number of times who said every time you give up a bad goal, you got to go get two more. So stop giving up bad goals. It's like every member you lose, you got to get two to make up for it.
That's right.
So and talking about tools and resources, like that's something that we really talk about here, with the agents that we work with, that, every agent that partners with us, whether it's with one carrier or with 5 or 6, we like 5 or 6, but hey, if you just want to bring one carrier to us, that's fine. We really think about, are we putting tools in the toolbox for that agent? It's one thing to send someone out to build a house with a box of nails and a hammer. It's a whole nother thing to send them out there with a box of nails, a hammer, a screwdriver, a drill, a level, all of those things. Like let's fill up the toolbox and try to make the agents as successful as possible. And that's at least our focus and something that we take really seriously.
It's a good one.
Yeah, for sure.
Absolutely.
So, Rodney, this has been great. Last chance. Do you have any other 2022 benefit information you want to give today?
July 28th. We will load you down with benefit information. July 28th.
All right, that sounds good. So stay tuned because I will be coming to you live from Miami, Florida on July 28th to try to give you the sneak peeks of what's happening with the UnitedHealthcare 2022 benefits. So we will be back with you on Monday, June 7th. This has been Rodney. I'm Bill, and this has been Near and Far. Thanks for joining us. Enjoy the weekend.